So you've noticed red areas on the head of the penis, and they may be burning or itchy or maybe asymptomatic. And your first thought may be, yikes, I have an STD, but I didn't do anything, or I used the condom, I swear. So maybe you have balanitis, inflammation of the head of the penis in the foreskin. Yuval, Bibi, Dermatologist. In this video, I'll give you the full guide to balanitis. What is it? What major types are there? How is it managed? Who to see to manage your condition, and I'll provide the best skincare approach to balanitis, which will help you supercharge your recovery process and is so often missed and lost in the shuffle of treatment. So do not touch that dial. Before we get started, I want to stress a persistent problem of the head of the penis must be diagnosed and managed with the help of a doctor, namely a dermatologist. There are a lot of moving parts, and while I'm here to educate you, get your bearings, and understand how to best manage your condition, ultimately the best management is done with the help of a doctor after a proper diagnosis of your condition, often prescription medications, and then a prompt follow-up with your doctor. So if you are having persistent problems on the head of the penis, your next stop should be your dermatologist office. Now, what is balanitis? Balanitis is inflammation of the head of the penis and the foreskin. It usually appears as red patches or red areas on the head of the penis and the foreskin naturally. Sometimes with scales, sometimes without it. Sometimes balanitis can have erosions or sores in it, and sometimes it can have other features depending on the cause of the condition. There are many types of balanitis. The most common ones are the inflammatory idiopathic balanitis, like Zuhn's balanitis, psoriasis, seborrheic dermatitis, or lichen sclerosis, otherwise called balanitis xerotica obliterans. Contact balanitis, either allergic or irritant, caused by a contact with an allergen, as in the case of allergic contact balanitis. And an allergen is a substance that your immune system has been sensitized to, like fragrance or a preservative or another compound in your skincare that has been applied to the area consistently, leading to development of the sensitivity and ultimately to balanitis. In the case of irritant contact balanitis, an irritant, something with extreme pH, for example, or some other cytotoxic properties, was applied to the area. Or alternatively, intense friction to the area can lead to balanitis as well. Then there's infectious balanitis, where the most common would be candidiasis, ringworm, or herpes simplex infection of the head of the penis, with bacterial infections being far more rare. Bacterial infections can be extremely painful, red, and swollen, and they present a medical emergency. Erythroplasia of Curat is squamous cell carcinoma in situ of the head of the penis that appears in many cases like balanitis, but it is usually slower to develop than most cases of balanitis. However, again, if you have a persistent lesion on the head of the penis or the foreskin, see your dermatologist for further evaluation and diagnosis to make that distinction between skin cancer and balanitis. How's balanitis diagnosed? Well, with the help of a doctor, namely a dermatologist. There's going to be an interview asking you a few questions about the history of the condition, then physical exam followed by possible testing. Usually the diagnosis can be made without testing. However, there are cases that are tricky on appearance and other issues and may require additional testing. Sometimes a KOH prep to diagnose fungal or yeast infection or a culture may be appropriate, and sometimes a skin biopsy may be in order, which is taking a small piece of skin from the area, submitting it to the pathology lab, and getting that diagnosis on a microscopic level. How is balanitis managed? First, remove or treat the offending or causing agent. Clear your environment of allergens or irritants. Throw away anything that may have led to the episode if we are dealing with allergic or irritant contact balanitis. If you have infectious balanitis, that obviously needs to be treated with specific treatment that fits the condition, fits the infectious organism to clear that infection up, and prompt follow-up with your dermatologist, obviously. If your balanitis is related to vigorous sexual activity, take it easy, cowboy. You cannot keep on pounding at it and expect improvement or the condition to go away. So a break from sexual activity may be in order. And now let's touch base on exceptional skincare. So any kind of balanitis, no matter what the cause is characterized by undermining or disruption of the skin barrier. That is just a fact of inflammatory conditions. Any inflammatory condition affecting the skin will cause disruption of the skin barrier. So first of all, do no harm as it relates to skin. So avoid cleansing and scrubbing of the area. Avoid hot water over the area. Those are all abrasive to the skin barrier. And remember that in no shape or form is balanitis a hygiene problem, meaning you cannot cleanse yourself out of any form of balanitis, but you will cause disruption of the skin barrier and may actually slow down recovery, no matter what the cause of the balanitis is. So stop abrasive practices altogether. Wash the area with cool or lukewarm water, splashing the water on the area. Very importantly, avoid scrubbing, exfoliation, or any physical abrasion of the area, as you would avoid vigorous sexual activity while recovering from balanitis. Please avoid any physical abrasion of the area, as that is one of the most harmful things one can do to an area of the skin that's already been worked over and suffering from chronic inflammation. When you get out of the shower, pat yourself dry. Don't rub the area once again. Then follow up by applying an occlusive moisturizer such as Butter Oasis, Butter Blossom, Moisturizing Balm, or petroleum jelly. Avoid water-based products like lotions, creams, and most other skincare products for that matter, as those may provide very little benefit up front and may disrupt the skin barrier on the back end as well. If you are sexually active, consider using an oil-based lubricant such as Butter Oasis, Butter Blossom, maybe coconut oil, maybe even petroleum jelly, depending on your preference, to mitigate friction over the area. For chronic and stubborn cases of balanitis, specifically chronic inflammatory idiopathic balanitis, slugging may be something to help you out, to help you recover and turn things around. Slugging is the very heavy-handed, generous application of an occlusive moisturizer to a specific area of the skin overnight, allowing that area to recover its skin barrier function in the best way possible. When you wake up in the morning, you may pad the product away. Most cases of chronic balanitis, such as Zun's balanitis, psoriasis, seborrheic dermatitis, lichen planus, or lichen sclerosis will respond to topical steroids or topical calcineurin inhibitors. However, there are nuances to these treatments. Different condition types and different circumstances require tailoring different treatments. So please be mindful of the necessity to tailor-make the treatment to your needs and your specific condition, for which I want you to see your dermatologist and have that discussion. Manage your expectations appropriately. While balanitis or most conditions of the penis respond to treatment, to appropriate treatment that is, within days or short weeks, some cases of balanitis may take a while to respond or may be resistant to treatment for that matter. So please manage your expectations as far as your own type of balanitis, the specific case that you have, specific medications that are used, and know what to expect. Know the time frame in which things should be getting better, what to notice for regarding potential side effects of medications, and when to see your dermatologist, including scheduling a follow-up visit in the initial period of treatment so you can have the confidence that things are actually turning around and have a guiding hand in managing your expectations and your condition. Report any unusual responses, reactions, or side effects to your dermatologist immediately. Avoid falling through the cracks and going at it alone. And remember that unfortunately some cases of balanitis are chronic, meaning they will keep coming back, and your best approach or best care would be to keep them away for a while and manage recurrences as needed. While circumcision is offered to improve some cases of balanitis, I think it should be a last resort option. Balanitis is most often well managed with great skincare and appropriate treatment to address the condition. Circumcision should be reserved to those cases where nothing else worked and the balanitis still persists, causing significant damage and significant disruption to one's quality of life. If you think that this may approach be right for you, have this discussion with your urologist or your dermatologist to clarify. So this is your complete guide to balanitis. First, follow up with your dermatologist to make the diagnosis and determine management. Follow with great skincare to facilitate the healing of the area and response to treatment, hand in hand with great appropriate treatment to fit your condition and your specific needs. Third, be sure to follow your response promptly and get control of the situation fast. Now, go get him, Tiger. Let me know in the comment section how you found this video helpful. Also, don't forget to share, like, and subscribe for more no BS skincare advice. See you next time. God bless.